Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Mujahid Buneri. Welcome to my channel. This is my first video lecture. I welcome you all from the core of my heart. As you all know from the headache, today our topic of discussion is Restless Leg Syndrome. What will be the objectives of this lecture? At the end of this lecture, I want my students to know: number 1, what is restless leg syndrome? Number 2, what are the causes of restless leg syndrome? Number 3, how will you diagnose restless leg syndrome? Number 4, what are the treatment options? And the last but not the least, at the end of the lecture, I will ask 3 questions which will be your homework. You can give your answers in the comment section. Okay, let's begin. What is restless leg syndrome? It is clear from the name that it is a syndrome in which there will be combination of signs and symptoms, which I will tell you in the next slides. It is also known as Ekbom syndrome. It is very common disease as it affects up to 2% of population. Now, when you take history from patient of restless leg syndrome, in 50% cases, family history will be positive. It is usually idiopathic. Other causes which may cause restless leg syndrome include iron deficiency anemia. It is the most common cause amongst the known causes of restless leg syndrome. You all know that iron deficiency anemia is very common in women. So, restless leg syndrome is also commonly occur in females. However, males are also affected. Second cause is diabetes mellitus, where restless leg syndrome can occur. Third cause is uremia. In chronic kidney disease, this syndrome can occur. The fourth common cause is pregnancy, in which restless leg syndrome can occur. And the last is peripheral neuropathy. Now, how will you diagnose a patient of restless leg syndrome? Number 1, from history taking, it includes the clinical features with which the patient presented to your clinic. Number 2, relative examination of patient. Number 3, investigations for finding the cause of restless leg syndrome. Now, the clinical features include: number 1, there will be unpleasant sensation in the legs during period of rest and inactivity. Number 2, these uncomfortable sensations will occur when patient is tired in the evening and at the onset of sleep. Number 3, these symptoms will relieve by moving the legs or with walking. And number 4, these symptoms will be aggravated by caffeine intake like tea and smoking, etc. So, be aware, smoking is injurious to health. Okay, dear students, now I come to examination. You will examine the patient to exclude other organic causes. And number 3, what investigations will you do? Number 1, complete blood count and serum ferritin level for iron deficiency anemia. Hb will be decreased and serum ferritin level will also decrease in iron deficiency anemia. The second investigation which you will do is pregnancy test. But are you with me? Okay. Do pregnancy test if patient is female and married. It is not necessary for all the patients of restless leg syndrome. The third important investigation which you will do is renal function test, and it is done for uremia. Fourth one is random blood sugar for non-diabetic patient and HbA1c for diabetic patient to see whether it is controlled or not. The fifth one and the last one is nerve conduction study for peripheral neuropathy. Okay. What are the treatment options? Number 1. Treat the underlying cause which I have mentioned above. Number 2. The first drug of choice for symptomatic control is dopamine agonists like Ropinirole. Number 3. Other options include benzodiazepines like Clonazepam, and you can also give the patient Gabapentin for their symptomatic relief. That's all, dear students. Now it's the time for question. Question number 1. What's the difference between restless leg syndrome and periodic limb movement disorder? Question number 2. What vitamins can help to reduce restless leg syndrome symptoms? Question number 3. In which age severe restless leg syndrome can occur? Hope you all will be good. Thanks for watching.